Welcome, good to see you. Thanks so much for joining us this evening. Thank you, thank you. We're going to jump right in. Thank you so much for joining us on this Wednesday evening. My name is Lily Talcott, and I have the honor and the privilege of serving as the Deputy Superintendent for the Ithaca School District. And alongside me this evening is Carrie Burke. I'll let her introduce herself.
Good evening. My name is Carrie Burke. I am the Coordinator of Health Services and Wellness for the district. Thank you for being here.
We're looking forward to spending the next 35 to 45 minutes really talking through the ins and outs of our new voluntary COVID-19 surveillance testing program that's going to be beginning on January 4th. So a question that we get often, right, when we're starting this conversation is why start testing, right? Why even do this in the first place? And really, truly, our goal is to support both in-person and distance learning as seamlessly as possible. And we know that by implementing a surveillance or proactive testing program, we can quickly identify asymptomatic folks who are testing positive, right, who are in our midst. And we can work with the Tompkins County Health Department to begin those isolation and quarantine orders that they're the only ones that issue, right, for cohorts and classes, as opposed to always just going with whole schools, right? So as you may have noticed, in the last several months, we had a number of situations where we would learn that an individual was positive for COVID-19, and we would need to take time to really work with the Tompkins County Health Department to identify all of the folks that were impacted, right? And that'll still happen. That's still going to happen with community testing and with symptomatic individuals as well. But this allows us a greater precision in order to just say, hey, there's someone in this class who may be positive through this antigen testing that Carrie's going to talk more about. And so we are going to send this class or this cohort home now because we know that they will be close contacts if that test through PCR testing is in fact positive. So Carrie's going to talk a little bit more about really the specifics, and then we'll even show you a video, and we will stay on until we've answered all the questions that are coming in the chat. Please feel free to type those questions in as we're talking and send them directly to Emily Tracy Arm. And at the end, we're going to make sure that we get to all of the ones that are listed. All right, Carrie, go for it.
Thank you so much, Lily. Good evening, everyone. For those of you who may have joined late, my name is Carrie Burke. I'm the Coordinator of Health Services and Wellness for the district. And so a brief overview of what we're doing. And it's important to note that we are standing up a voluntary testing program. So persons who their parent or caregiver consent will be eligible for testing, as well as staff. This is entirely voluntary, but our goal ultimately is to test 20% of our in-person students and staff over a 2-week period. Every 2 weeks, we will have tested 20% of a building population among those who are consented. Again, this is not mandatory. We will be using the Abbott Binax Now Rapid Antigen Test. These are tests that are designed really for surveillance purposes. They are not diagnostic tests. They are not molecular tests. So persons who test positive using these rapid antigen tests do have to pursue confirmation testing that's available through Ithaca Health System. The rapid antigen tests are very simple to utilize and operate. They require a non-invasive nasal swab. So many of you may be familiar with the nasopharyngeal swab, which goes much further back into the nasal cavity. These swabs require a few seconds in the front of the nose for collecting that sample. And results are available very quickly within 15 minutes. These tests are being provided to the school district by the state of New York at no cost to us and no cost to you. So where will we be doing testing? We will be doing it at school sites. Within our school sites, we've worked with our administrators and our school nurses to identify appropriate spaces for conducting testing. So these are spaces that are empty classrooms or other congregate or non-instructional spaces where testing would be appropriate. Our testing is beginning on Mondays. As Lily mentioned, our elementary would be tested every Monday. And then our secondary, because of the hybrid model, testing would occur both on Mondays and Thursdays to ensure that we're testing both cohorts of students. And again, I think I mentioned earlier about how we'll be testing. It involves a swab at the front of the nose. Many of our older students and our staff will be able to self-sample, so they will be doing that under the direction of a trained observer. And that minimizes risk for all those involved. Although we appreciate that some of our youngest learners and other select individuals may need assistance with collecting samples, and the school nurses would be the ones collecting those. So if there are any positive cases, which I think Lily alluded to earlier, that we would alert that particular class or that cohort, and we would be contacting parents and caregivers to come retrieve them from school as soon as possible.
Thanks, Carrie. So again, we wanted to just remind folks this is voluntary, and also we're shooting for Monday mornings and Thursday mornings, again, to really think through and support contact tracing purposes. We know that the Tompkins County Health Department has a 48-hour look back period in terms of who those folks are that positive individuals have been in contact with. That close contact is determined to be, 6 feet or closer, right, 10 minutes or more. And we have been, of course, really working in partnership with them to support those efforts. So again, we're shooting for these Monday mornings. We know that this first week or these first couple of weeks, we are going to really benefit from everyone's patience as we set this up. And so it may take slightly longer, and I think everyone expects that, right? And then Thursday mornings will be for our secondary students as well, for those who are in the red cohort. Again, it's entirely voluntary, and I'm going to show you now how simple it actually is. We're going to take a look at a quick video. I'll be honest, the sound isn't fabulous, but there are subtitles. So you can certainly hear that way as well.
First step is to take the liquid and put 6 drops in the top hole. And it's important to keep this flat so that the liquid doesn't go anywhere else. And then you take the nasal swab, which looks very much like a Q-tip, the soft cotton tip there, and then you insert it into each nostril. You can swirl it around a little bit, but you want to go just enough that you feel a little bit of resistance. Take it out, go to the other nostril, same idea, 3 to 4 seconds. And then you insert it into the bottom hole of the 2 in this kit. And then you turn it several times so that the specimen can mix with the liquid that you've just put in. And then you take this adhesive strip here off, just peel it off like that, which allows you to fold this closed and so it stays closed. And then you wait 15 minutes for the result to come back. And on that card, there are lines that will show the result in 15 minutes. But it's important not to interpret the result too early because it won't be accurate. So you have to wait a good 15 minutes that blue control line will go away as the liquid goes up that little piece of paper there in the kit. And what ends up will either look like two lines there on the left, which is a positive result, or only one line on the right, which would be a negative result.
All right, so that is a really quick, simple overview of the actual test itself. And again, Carrie indicated that students and staff who are able are going to self-swab, and the nurses have been amazing and will be swabbing for those younger learners or those who need some greater assistance as well. I want to make sure that everyone knows that there is a website that's up and running. It has a very lengthy FAQ section, frequently asked questions section, and we've got this custom URL here. So if you want to pop that in and take a look, if you are more of a visual learner, you know, we'll talk a lot. We'll take the questions, the great questions that are already coming in, and but if you need to refer back to anything, please feel free to take a look at that. You can even watch that video again. There's another video as well that's out there too. All right, with that, we're going to transition to questions that folks have. And as I said, we've already had some great ones that are coming in. So we will jump right there. All right, so there's a question that came in from a caregiver. Carrie, do you want to talk a little bit about this? If I don't want my child tested every single time that it's offered, will they still be able to be tested at all? Carrie, go for it, and I'm happy to jump in as well.
Thank you, Lily. That's a wonderful question. I'm glad someone asked that. Yes, I would indicate that this testing program is voluntary, even up to the point of sampling. So if we've got a kiddo or a staff member who has previously agreed or has consent on file to be tested, and they arrive to the room and they just feel like, you know, I'm not feeling it today, we are not going to compel anyone to be tested who does not want to be tested. And we recognize, certainly for some of our younger students, it can be, you know, in a place where they may have some fear, anxiety, and so we're being very thoughtful about how we introduce this to students in the school setting, and making sure that, again, at every stage of the process that they are engaged as a willing participant. So if there's, I would add too, and I think there's a question to this effect, you know, when we look to engage in testing, we are looking to engage in sampling a portion of our school population so that ultimately and ideally a given student isn't being tested every week, but maybe every few weeks. And that will largely rely on how many parents and caregivers consent for their child to be tested.
Yeah. You know, I think it's also important to note, as you all may have heard around the state, we're currently not in a yellow, orange, or red zone in our county, or of course within Ithaca itself. So although we're modeling our program after the yellow zone parameters, we're not required to do, frankly, any testing. And I will say too, we're also really grateful for the partnership with the Tompkins County Health Department and the New York State Department of Health for providing these kits to us at no cost, which has been extremely helpful. There's a question about whether all staff are going to be tested. And again, I'll reiterate what Carrie said earlier, which is that the testing program itself is voluntary. We are offering it up to all staff. There's another good question a little bit later about whether particular staff who may be in higher risk situations, right? So say, you know, I used to be a classroom aide. Say I'm in a classroom with a couple of kiddos who have mask exemptions. Would I perhaps be offered testing more frequently? And we are certainly open to that, right? And so we're working through all the protocols with our wonderful nurses, our medical director as well, and I think that's a wise suggestion, and certainly something we'd like to explore further. And I think initially yes, right? So the other question is, are we talking about only 20% of those who have consented, or are we talking about 20% of the entire in-person student and staff population? Carrie, do you mind speaking to that?
Oh, excellent question. Thank you. Yes. Well, we ultimately we would love to have 20% of the entire building participating over a 2-week period. But again, recognizing that this is voluntary, in fact, that 20% would be a portion of those who have consented and agreed to participate. I think in preliminarily, based on consents that we've received to date from parents and caregivers, that we're in very good shape, I would say, certainly in meeting that minimum threshold of 20%. And in many cases, we have clear majorities in our building.
Thank you. All right, we've got another question about whether caregivers can be notified if their children are being tested on a particular day, and whether caregivers can be present during those, perhaps in the first testing that takes place. We certainly will try our best. There are a number of principals who are working through processes to try to identify those kiddos now who are going to be tested on Monday. We also know that there are permission forms that are rolling in even right now. So so we know that may shift. And so we will certainly try to notify families in advance. And we also know that we're aiming for this 20% and over the course of 2 weeks. And we may have absences, we may have little consent in a few number of permission forms from caregivers in another cohort, and then have to shift to another one in order to really continue with our protocol around the 20%. So again, we'll do our best, but it's certainly not an absolute guarantee. And then the other question is a great one. If your kiddo has a lot of anxiety about getting tested at first, we totally understand. But we're not going to be having visitors and anyone from the outside, other than our folks who work within the building and for the school district, to be coming in during that time. I will tell you that there have been a couple of folks who have, or at least one individual who's told me they've used a Q-tip with their child just to say, hey, it's going to be more like this, and you could do it yourself, to kind of ease some of the anxiety. And that may or may not work for your kiddo, and we absolutely understand. And you may want to talk to your child's principal or nurse or teacher in order to kind of work through some of that as well. There's another question around, so if it's voluntary, does this mean that you can't send your child to school if you don't consent to it? The answer is you can continue to send your child even if you have not filled out that consent form or you have explicitly said no. So public health law requires active consent from parents and guardians for any medical test. So we cannot require folks to do this unless the public health law changed through New York State. So there's another question about, like, why voluntary? When has that ever gone super well when we've left things up to individual choice? I can tell you, as of yesterday, we had about 1,600 consent forms returned when I last checked it about midday. And so we're doing relatively well in terms of collecting those consent forms at this time, and we certainly have enough to get through those first 2 weeks as well. Carrie, do you want to talk a little bit about quarantine? We've got 2 questions in here, great questions about why are we quarantining an entire classroom of students when they are more than 6 feet apart, and they are, or why is the health department quarantining? Pardon me, that was definitely a misstatement on my part. Do you mind just talking a little bit about their process and clarifying what our role is and what their role is?
I'd be happy to. Thank you. Yes. I think first and foremost, it's important to just note what quarantine is. Quarantine is otherwise healthy persons who've been exposed to someone who is positive for COVID. And so the idea is that you are restricting your movement and maintaining your distance from others for a 14-day, actually now 10-day period. It recently was revised by the New York State Department of Health, so that should you become positive for COVID during that time period, that you really minimize the risk to other persons. So quarantine involves otherwise healthy persons through being taken out of circulation, for lack of a better term, right? They're not going to work, they're not going to school, they're staying home, and the health department is checking in with them daily to monitor their status. With respect to quarantine, those decisions are dictated by guidance from the New York State Department of Health and our local health department. They have erred on the side of caution in many cases. I think someone has noted or indicated that it seems like everyone in a room is quarantined regardless of where the positive person may have been sitting. And I think that's, difficult, particularly in congregate settings like schools or otherwise, where even if the positive person may have been seated here in the course of a school day or a period, there may have been movement within the room, et cetera. So they err on the side of caution with these decisions, and we've followed through on their recommendations and guidance in this area.
Thanks, Carrie. We, again, have collaborated closely with them, the health department, and any class in which there is a positive antigen test. We have very clear instructions for the person who tested positive, right? That includes you must get PCR testing as a follow-up, right? And here's what isolation looks like in the meantime, right? And you will be hearing from the health department. And then also very clear outline around quarantine and what that means for the students who are and staff who may be considered close contacts. And again, we need that confirmation through the PCR testing, right? That's the gold standard of testing. And then the health department follows up from there. There's a question about how staff can volunteer for testing, and you can let your principal know. Yeah, certainly. Shoot them an email. There's a question about voluntary testing and whether it has inherent bias. Great question, right? So those who are checking their email, are they more likely to then be the ones who are tested? And at first that may be the case, right? But given that we were fully virtual when we sent out these permission forms, these consent forms, we have printed hundreds of them and already delivered them to schools. We translated them into 5 languages and printed them and set them up in schools. They're also available online as well. For anybody who doesn't have their consent filled out, when we return, we'll have that paper copy, right? And our principals have been awesome about following up with families, and certainly we'll be looking forward there. Carrie, can you talk a little bit about false positives and false negatives? And would you mind talking a little bit about return to school and what that means if you do get a positive antigen test?
Yeah, I'd be happy to. I'll talk about the latter first. So again, individuals who have a positive antigen test will need to seek out and receive a PCR test. And so, as Lily indicated, that detects COVID at the molecular level because there is the risk of either a false negative or a false positive, right? A false positive where the antigen test suggests that you are positive for COVID, but in fact, you are negative. And conversely, a false negative that says you are negative and in fact, you may be positive. Now, it's difficult to talk about that false negatives and false positives without discussing context because the risk can vary of a false negative, false positive based on prevalence in the community. So as you might imagine, as prevalence or cases increase in a given community, the risk of false positives drops off, right? Because if there's more COVID in the community at a given point in time, the likelihood that someone's testing positive falsely on the antigen test kind of falls. And so there's some good data out there. I think a few studies done other than by the manufacturer that we can certainly make available for people who want to get into the weeds around false positive and false negative. That risk exists, but that's also why we're asking people who test positive on the antigen test to then get confirmation testing via PCR.
Great. And Carrie, let's talk a little bit about the process. If someone tests positive through the antigen testing, as you mentioned, around false positives, they again will be required to receive PCR testing. And again, that's that gold standard test through the Cornell lab. They're doing anterior nares, which is what we're doing. There's also saliva-based testing in our county and nasopharyngeal testing. Those are all PCR tests. So they're run through that process and they're detecting, at the molecular level, whether there's COVID-19 present within the individual. They're highly sensitive and they're highly specific, right? If that comes back positive, then the Tompkins County Health Department begins the quarantine and isolation process in earnest, right? And so we ask folks to do that as quickly as possible and get that follow-up testing so that we can know where we are, right? If that comes back negative, then folks are released from any sort of shift to full distance learning, right? Or distance learning and teaching. We need, of course, proof of that, right? So similar to return to work, return to school protocols, right? If my daughter's sick, right, she has a fever, I can't come into work until, she goes to the doctor. The doctor has always asked her, to get a COVID test, and then I have to turn that in order to return back, right? It's the same kind of process. And then folks return to the classroom. And there is a question about folks who are virtual, who are participating in after-school activities and whether they'll be tested. They will certainly be offered. That's a system that we, it's very, very few number of kiddos, but working through that process as we work out a number of the logistics for the in-person students who are attending as well. There's a question about the ways in which we're preparing young people. Are we incorporating it into our curriculum? In what ways are we supporting our young people? Obviously, things like this can be helpful. We've worked with staff and offered a couple of staff sessions as well. There are a number of resources that are linked on our website as well. And there are a number of teachers who have already started talking with their kiddos about this as well. Our nurses and our principals and the trained observers have been wonderful. I cannot sing their praises enough. All of our administrators who have been involved and all of our nurses, our medical director, just fabulous. And they're really keeping a very kid-centered approach to this whole endeavor. I've been really, really impressed with them. There's a question about giving consent, and can it just be for one time? And if the kid doesn't resist in any way, that we don't further pursue testing. And if you have a special circumstance, please email your child's principal and nurse. I think that would be a great combo. And we have, in all of our conversations with folks who are engaged in this testing operation, all the trained observers and all of the nurses, if kids or staff resist in any way, we are calmly and carefully allowing them to head out, right? We certainly don't want to make this a traumatic experience for folks. There's a question about whether students will wait for the result before going back to their classroom. No, it takes 15 minutes. Students and staff will wait back with their cohort. So if I'm a staff member with a cohort, I'll wait there. If I'm a staff member who's maybe not, I have a free period that period, I'll go back to maybe my office or my classroom, right? And then the results be communicated shortly thereafter. Obviously, if there's a positive, we immediately alert folks, and folks will receive an email afterward if it's undetected, right? Or what we may consider negative. It's, the proper term is that the virus was undetected. Right? Staff will certainly be able to receive that sooner, right? They don't need to wait for an email if they're there. They can say, hey, right? So there's a question that about really clarifying that process, Carrie. So kids, say a kiddo is positive in a class or cohort, and then what happens, right? And I can kind of start that process, and then maybe you want to follow up. So what happens is we start to call. If I were still a principal, I would begin calling, perhaps with again, maybe the wonderful front office staff, right? We have talking points for how to make that phone call. And I would say, I would call for one of two reasons, right? One, your child received positive on this antigen test, and you need to come get them now, or someone needs to come get them now. And this will mean they'll need follow-up PCR testing, and we've got information on where to go on this paperwork that we'll provide, that we developed in consultation with the health department, right? And those may be longer conversations, right? And we're going to allow families to be the ones to tell their young people, right? If there's a positive, if they're likely going to be subject to quarantine, then we don't issue quarantine orders. We ask that folks act as if they are in quarantine until those PCR results are confirmed. Either let us know either way. Carrie, anything I'm missing in there that you want to?
No, I think that we're thinking very carefully about communication with respect to testing, and that includes follow-up. So if in fact the person who had a positive antigen test goes on to have a positive PCR test, the health department would be first advised of that in many cases, and they would then reach out to yourselves and others in that who are in that classroom space or in the school space to begin quarantine or isolation in the case of a positive person. And if the test comes back negative, then we would again alert those who we've sent home to engage in distance learning, that they can safely return to the classroom and to the school. So it's important to note that, again, I think Lily said this earlier, that only the health department has the authority to isolate or quarantine individuals. What we're doing is we're responding to a preliminary result and taking a precautionary approach and asking people, students and staff, to leave the building and remain home until we have confirmation.
Yeah. Great. Thank you. There's also a question about really that process again afterward. And I should mention we haven't been able to say this very often in the COVID era of schooling, but we've had the great good fortune of learning from other people who have already done this, right? So we've spoken at length with folks in other school districts that have been implementing this for months now. And we're frankly borrowing just many of their processes. So the process, for example, of sending kids back to their class or cohort, and there's a question here about secondary students, that's why we're really shooting for first period. We know that those first few days, that may be a challenge, and we're gonna, of course, do our best, but we also know we have to be patient with ourselves and the folks involved. That if it occurs during first period, that means that they've already been with those people, right? They've already been with those folks. They're already masked, right? They're still there. And so notification, having families be the ones to notify their children when they are picked up or after they're already picked up, allows for a level of confidentiality that we would that we need, right? So rather than going in and pulling one kid to the side and telling them that they their antigen test revealed a positive and they need follow-up PCR testing, we've learned from other folks that's really, it's a much better process to have the caregiver be the one to notify them, right? We also know that middle school and high school students may have cell phones and may begin texting each other and trying to figure out who it is, right? And so again, some of those talking points that we've developed for folks really revolve around compassion and care. And we know that we certainly can't control the actions of others, but we can put forth and really engage in some of those conversations with the students around respect and really caring for one another and maintaining that confidentiality, right? Caregivers are great partners in that too, so we appreciate any support you can as well. There's also a question about about whether, testing, people are going to be maybe really excited about it. Are we going to be able to open up more in-person spaces for those who maybe initially elected to be virtual only? And again, those those surveys have gone out to ask families if they'd like to engage in conversation with the principals or associate principals, and we are trying to do our best to expand the the possibilities for in-person. And we also know that given the continued requirements around physical distancing and our current space configurations paired with staffing, all of those things combined to make it really, really challenging to offer it up to absolutely everybody. There is a question about the lunchroom and whether there's been consideration around changing how that is set up. For example, at some of our middle schools, there might be 40 students in a given space eating lunch together 6 feet apart, of course, or more. But is there any consideration around maybe decreasing the number of people in that space in order to, again, minimize the exposure there. If possible, that would be great. But again, staffing and contractual obligations that we absolutely have to follow make that tricky, right? So we may not have a great number of staff members available in order to supervise. So the times when I've supervised lunch, for example, you know, I've either been in a classroom with a cohort of kiddos, or been in a slightly larger space, like say the library at Boynton. It's all because someone was out, right? So the deputy superintendent's there to cover lunch and provide some support. So you can maybe with that understanding, you can get an appreciation for just the intense staffing needs that brings up for us. All right. Thank you so much. There's a lot of big questions that continue to come in. There's a question about whether if there's just one person pulled out of class to do testing. So if there's just one kid who's consented and then the whole group goes home. And that's a great point. That's, you know, we're going to work to make sure that there's more than just one kid or two kids in that space who can receive testing. So we might move to a different cohort until we can secure testing. Again, they're rolling in, they continue to roll in, and anything you can do to remind people and suggest that would be really great.
Lily, can I add something there?
Sure.
I think it's important to note, again, speaking to these concerns around confidentiality, as a what if, for example, like at the secondary level, and we're looking to test people during that first block, that first 88-minute period, is that our aim is to test everyone who's eligible in a given class. So say it's first period chemistry, and there are 12 students in the class, and 10 of them have a consent on file to do testing. If the first person we test is positive, we would continue to test the rest of that cohort, right? Because I think, one, it's important to know if there are any additional positives in that space. And two, I think it also lends itself to these concerns around confidentiality and the student's right to privacy, right? We would not turn around after, say, the first or second student tests positive and then say, well, we're done with testing and this class has to go home. We are seeking to test everyone in that cohort, ideally within that first period, so that limits the number of potential persons who may be subject to quarantine. And it also helps to support a greater right to privacy around testing, right? So we would test everyone in that cohort during that time period who's eligible for testing, and not halt testing should like the second or third or fourth individual test positive. So I just want to make sure that that's clear.
Cool. Thanks, Carrie. We've got two more questions, so we're going to wrap up after these unless we start to see some more coming in. We're really trying to just answer every question that's coming in. So if you have anything lingering, no question is too small. It's okay if we've already talked about it and you need us to repeat it. It's totally, totally fine. Please get those in because we're getting close to the end here because we're not seeing any more come in. Okay, so there's a question about if a student or someone in the cohort tests positive through antigen testing, at what point do we transition to virtual? So at the secondary level, that's obviously much more seamless, right? Because they're already participating both in person and virtually. Big, huge shout out to our secondary teachers who have been doing that. Oh my gosh, you are amazing. I actually think I saw one of them on here, Matt Prokosh. Amazing teacher. And so secondary students are just going to make that transition, right? And for elementary learners, our elementary teachers have had really, I think, really great judgment about what makes the most sense. If we're talking about a pre-K class, It might be, okay, let's hop on at the end of the day, here's the meat, right? If it's a fifth grade class and they were in the middle of, you know, a big unit on decimals and they want to jump back in, it might be like, okay, go home, have some lunch, and then at 12 o'clock, we're going to jump right back on, right? So teachers, you know, we trust our teachers' judgment in terms of how the rest of that day they will roll. We're really grateful for families and our staff who have done a great job of sending devices back and forth, even with our very youngest learners, that allow for that really quick transition. So that's been fabulous. And we really appreciate everybody's support there. Let's see, we have another couple of questions. Oh, good, more are coming in. All right, there's a question similar to what you had talked about before, Carrie, if you wouldn't mind just talking a little bit about the false positive rate for the Abbott Binax now, and maybe just and how that's related to community spread and the numbers within a given area, or the positivity rates within a given area, and then maybe just indicate where that'll be on the website as we put that up. Okay.
Yeah, happy to. Thank you. So the false positive rate is certainly influenced by what's happening in the community. As the prevalence of COVID, should it be increasing, the likelihood of a false positive will decline, right? Because with more COVID circulating, someone testing positive, an antigen test has a greater likelihood of actually being positive for COVID. So there's, in addition to research that we'd be happy to post on our website, on the testing website, so you can access that directly. The false positive and false negative rate are influenced by what is also happening in the broader community. And those studies are also sensitive to the fact whether the tests are being done in persons who are presumed positive or symptomatic versus persons who are asymptomatic, et cetera. So it's hard to give a definitive answer around that because there are contextual elements that can play into the likelihood or the rate of false positives or false negatives.
Yeah. Thank you. All right, question about what happens with siblings if if someone is tested, right? So if someone who lives in the same household, let's be clear, because there are some non-siblings who may live in the same household, or say my daughter was attending a school and I was, teaching in a different classroom, right? If I were positive, my daughter would also leave, right? Even though she wasn't positive, right? None of that. We would both need to leave school, so that's part of our process and protocol. But in terms of testing, that would be an individual family's decision if that sibling is also going to be tested. And our Tompkins County Legislature has been amazing in terms of providing testing at no cost to county residents. Again, that's a caregiver and a family decision. We've got a couple of questions about testing during class time and what the implications are there. Is there any consideration about testing during non-class time? And could we also maybe rotate some of the classes that we're testing within, right? And the answer to that is, we're really aiming for, doing it as quickly as possible, right? It really doesn't. You saw on the video, all we're talking about is actually the swab, right? So kids come in, a little bit of hand sanitizer, swab, and they're gone, right? They're back with their cohort. And as much as we totally understand that there are concerns around missing some of the class time, we also know that this is an important element of really continuing that class time going in general, right, entirely. So we understand that this is a trade-off and it's not everybody's favorite. We do understand that for sure. There's a question about will we let families know how many kids within their cohort have consented to testing? We won't be, but feel free to reach out to the other caregivers within your child's classroom. You know, if you have some sort of email listserv, et cetera, to encourage and support as well, that's totally fine. There's a question about whether folks can do the testing at home and then just bring it in. And at this time, we're not offering that as an option because we have to function under New York State laws around limited service laboratory requirements. So there are specific sites that we're permitted to engage in testing, and there are some that we're not. So, like, it can't be at your house because we don't have the rights to test within your home. But it's a good question. It is authorized for in-home use. Individuals would have to purchase it. All right. I see there's another question about the false positive rate. And yes, we will certainly publish what the company itself has put out. Yeah, I think that was the other question there. Great. All right, folks, we'll post this on our website. You can always feel free to email me directly or email Carrie directly. I'll say email me first. Let's let Carrie have a little bit of a break. I'm happy to take your questions. It's just lily.talcott@icsd.k12.ny.us. You can always call my office as well. I'm happy to take your questions. I try to be really good about getting back to people quickly, and just really appreciate all that you're doing to support your young people and to support your families during this very strange time. Thanks so much for your engagement, and thanks, and have a great new year. We'll see you soon. Thanks, everyone. Be well, take care of yourselves, be safe. Thank you.